Hey, Dr. Kenneth DeLay here, board certified urologist practicing in South Carolina. Let's talk about medications that can be used to prevent kidney stones. So I'm going to list a couple of them, and I'm going to list water as the first medication. This may seem odd, but we'll come back to it in a minute. The second would be a medication called hydrochlorothiazide or thiazide diuretics, and the third would be potassium citrate. There are other medications that we use less frequently, including allopurinol and something called Thiola, but those are used much less commonly, so I'm not going to focus on those as much. So the first, water. So what is the most common cause of kidney stones? Far and away, it is dehydration. So even when the dehydration isn't the most common cause, increasing fluid intake to dilute the mineral content of the urine is highly effective, even in genetic conditions such as cystinuria, where it is a amino acid transporter defect caused by genetics. One of the best things you can do is drink more water. So let's list water as the first medication. The second would be thiazide diuretics, including hydrochlorothiazide. So let's think about the reason this may work. So these diuretics decrease the amount of calcium which is put in the urine. So in a condition called hypercalciuria, they may be effective. So the third medication that we use is potassium citrate. So citrate is a compound which in the urine inhibits the formation of kidney stones. It also raises the pH, and in certain conditions or certain situations, a low urine pH can increase the chance of stones, particularly uric acid stones. So there are, once again, a couple of common reasons that you would have stones: dehydration, too much calcium or hypercalciuria, or a low pH or low citrate. The first, drink more water. The second, if you have too much calcium in the urine, thiazide diuretics. And the third would be if you have a low citrate or low urine pH, taking potassium citrate. Now, how would you know that you might need some of these medications? Well, we can order a test called a litholink, or a 24-hour urine sample, where you actually urinate in a jug for 24 hours. We measure the mineral content of the urine. We measure the volume of the urine, and this can help identify if there are specific abnormalities which we could address with these medications to reduce your risk of kidney stones. If you're a recurrent stone former, discuss with your urologist if there's things you can do to prevent future stone disease.